Hello, my name is Michael Giordano, and today I will be presenting on cerebrovascular accidents, commonly known as strokes. This presentation is part of my Pathology 2 course for Pima Medical Institute in the radiography program. What is a cerebrovascular accident? A cerebrovascular accident is defined as a disruption of blood flow to the brain. This disruption can be due to a blockage leading to a lack of blood supply, or a vessel rupture, causing a brain bleed. When the brain is deprived of oxygen and nutrients, brain cells begin to die, potentially leading to disability or death. While we dive deeper, it is important to note that there are two main types of strokes: ischemic and hemorrhagic. Strokes can be categorized into two primary types: ischemic strokes, which occurs when a blood vessel supplying the brain is obstructed, preventing oxygen from reaching brain tissue. Ischemia refers to a lack of blood supply to a tissue. This can be caused by either a thrombus or an embolus. About 87% of all strokes are ischemic. And on the other hand, we have hemorrhagic strokes. This type occurs when a weakened blood vessel ruptures and bleeds into the surrounding brain tissue. It can happen either within the brain itself or within the meninges. Hemorrhagic strokes account for 13% of all strokes and are often way more severe. Recognizing the signs and symptoms of a stroke quickly can make a difference. Listed are some of the common symptoms: trouble speaking, confusion, disorientation, difficulty comprehending speech, numbness, weakness, especially on one side of the body. You may also experience vision problems, severe headaches may occur, vomiting, and dizziness or trouble walking. Strokes can cause significant anatomical and physiological changes in the brain. The best treatments must be administered within 4 hours of symptoms being onset to be effective. A delay can lead to irreversible damage, in which most cases none of us want. Since early treatment is crucial, we would like to use the FAST method to identify a stroke. F standing for face drooping, A for arm weakness, S for speech difficulty. If you see any of these signs, it's T, time to call 911. These are your key indicators that someone you know is having a stroke. If you're going to take anything away from this presentation, it would be this slide, because you could help a loved one from life or death. Just remember, the brain has the ability to control movement, speech, and emotions and other vital functions, and if it's impaired, someone may be having a stroke. A stroke diagnosis requires a combination of clinical assessments with blood tests and imaging. Emergency room providers will be able to assess symptoms by using blood tests to check for clotting issues, blood sugar levels, maybe even some infections. CT scans are also used because it's the quickest and most accessible imaging method to diagnose strokes. In some cases, providers could use EEGs to measure electrical activity in the brain, EKGs to check for heart rhythm or atrial fibrillation to check your heart rates, and MRI also can be used to provide detailed images to confirm such details. When it comes to treatments for stroke, they vary on the type of stroke you have. For ischemic strokes, we can use medications like thrombolytic agents, which are used to unblock an artery. When it comes to thrombolytic agents, the process includes dissolving the blood clots to allow blood flow back to the brain normally. Also, the use of blood thinning medications and anticoagulants can be used in the moment or in the future to prevent such clotting of the blood. And on the other hand, for hemorrhagic strokes, surgery might be necessary to stop bleeding and to repair vessel abnormalities. Blood pressure management is essential to prevent further complications as well. This could all be assessed by a healthcare provider depending on which stroke is present. When discussing prognosis of strokes, survivors may experience long-term effects, including but not limited to paralysis, cognitive function decline, emotional instability on themselves or from family members, but they will also experience chronic pain, numbness in the extremities or in the body, and could lead to difficulty swallowing, speaking. Bladder and bowel functions may decline as well too. Looking further into the future of stroke patients, it's important to know that stroke is the leading cause of adult disability in the United States. Recovery and follow-ups depend on your stroke severity, but crucially, therapy plays the most important role in the whole rehabilitation aftermath. 3 listed here are the most common, which is physical therapy, which helps with walking, standing, coordination. You may or may also be prescribed occupational therapy. This assists with stuff like eating, using the restroom, getting dressed, and also speech therapy. This helps with patients recovering from difficulties with speaking and language. These are what to expect after you receive a stroke. In this part of the presentation is where we will be diving into the medical imaging for strokes. And this is the main reason why I chose this pathology. I love CT because CT is the most inclusive type of modality to assess and diagnose cerebrovascular accidents. CT imaging is the most preferred due to being the quickest and most accessible. When it comes to specifics, the type of order used in diagnostic process is a CT angiography, specifically called a CTA head and neck. A CTA is different from a normal CT scan. A CTA scan combines an ordinary scan with iodine contrast at a higher volume. This technique is able to create pictures of blood vessels within the head and neck along with the soft tissue. With the power of CT and the media iodine contrast, we can also create 3D post-processing visual renderings, which we will be discussing on another slide. Looking at medical imaging, we have ischemic strokes. As seen on these 2 images, ischemic strokes are easily identifiable because they appear as dark, hypointense areas on a CT scan. On the left, we have a current ischemic stroke at its first sign, first imaging. On the right side of this, we have an ischemic stroke follow-up scan. These are usually done within 24 hours of the initial stroke to assess swelling, possible infarction, and the bleeding. Here we have 2 pictures of a hemorrhagic stroke. When assessing hemorrhagic strokes, they appear as bright white hyperdense areas on brain imaging. On the left is a basal ganglia hemorrhagic stroke. These are really seen deep within inside the brain, kind of close to the midline. These are the ones that really affect motor control, cognition, emotion, and all that kind of stuff. On the right side is a hemorrhagic stroke at its first scene. Of course, very identifiable as it is not supposed to be there when you know brain anatomy. Here we discuss MRI imaging. It is very useful for detecting infarctions with the sequences it uses. However, MRI is less time efficient and it may also not be readily available in all healthcare settings. but it does create beautiful images where we can see all types of strokes. Here is where we have the 3D maximum intensity projections, also known as a 3D MIP. It is a post-processing technique used in CTA head scans to visualize blood vessels by displaying them at their high-intensity voxels onto a 3D animation image. It enhances detection of strokes, stenosis, and malformation. It works by acquiring data with the use of the identity contrast and the highlighted vessels. It pops those out and removes all other non-vascular structures out of the image so that we could use this 3D animation to be spinned, tumbled, and flip to see everything when it comes to arteries, cerebral connections, and mainly the circle of Willis, which you would see right here, which is a network of all arteries and vessels in the brain down to the rest of the body. In summary, I briefly described how medical imaging plays a role in diagnosing a stroke. I'd also like to express that a stroke is very common. It is important to recognize the signs early, receiving treatment as fast as you can, because you could be the one to save someone's life in this unexpected condition. Thank you.